Good morning, everybody. My name is Antonia Anoloha. I'm a DMP student from Brandman University. I'm in the class of Dr. Clary NURU 641. I'm here to present psychopharmacology case study using lithium. Lithium is the first drug and the oldest, most stabilizer, which is still the first-line treatment of bipolar disorder. It is used as a maintenance therapy for people with bipolar disorder. It reduces the rate of suicidal for bipolar disorder. It helps to treat and prevent both mania and depression in bipolar disorder. Symptoms of bipolar disorder: manic mood and behavior, euphoria, psychotic symptom, delusion, hallucination, dysphoric or negative mood, depression, anxiety, irritability, cognitive symptoms, racing thoughts, distractibility. Mechanism of action. Mechanism of action. The mechanism of action of lithium is unknown. It is rapidly absorbed and has a small volume of distribution. It is excreted in the urine unchanged. That is, there is no metabolism of lithium. Lithium modifies sodium transportation in nerve and cells and muscle cells. It changes metabolism of neurotransmitter, especially catecholamine and serotonin, by altering intracellular signal through second messenger system. Doses. Administration. You can administer oral or tablet, capsule, or in liquid form. Tablet form, you start with 300 milligram, or in capsule 150, 300, or 60 milligram. Important information one should know includes it takes about 1 to 3 weeks for lithium to show it first. Some people may show a partial decrease of the symptom, while others may not respond to the treatment. Consider plasma level and titrate the dose if the symptoms are not reducing. Lithium should be titrated gradually and for over 3 months. Rapid discontinuation includes the risk of relapse. Avoid using diuretic, Motrin, other blood pressure medication that will increase serum lithium level. Avoid the use of flagyl. Lithium toxicity has no antidote. Adverse effects of lithium: bradycardia, confusion, kidney failure, diabetes, anemia, nausea and vomiting, hypothyroidism. Treatment of toxicity of lithium is hydration and then stop the medication. You use hydration with normal saline, which will help to improve lithium secretion. Avoid all diuretics. Start dialysis on renal failure and give 20 to 30 milligram of propanol 2 to 3 times a day to reduce tremor. Contraindication: renal failure, cardiovascular disease, pregnancy and feeding mom. Monitor kidney function test, thyroid function test, electrocardiogram. Monitor the weight. Monitor level 8 to 12 hours after the last dose. Check the level 1 to 2 weeks until reaching the desired therapeutic level. Therapeutic ranges is 1.0 to 1.5 for acute treatment, then 0.6 to 1.2 for chronic therapy. Check the level 2 to 3 months for 6 months. Toxic level are more than 2. Identifying data, case study number 1, Mr. J, 36 years old, African American male, live with the wife and 4 years son, 3 years of married and recently lost his job, always get into argument with his wife due to stress for losing his job. The source of information was obtained medical record and patient. Chief complaint, nervousness, insomnia, irritability, and mood swing. Current medication, Ultran 50 milligram Q8 hours, PRN for back pain. Social history, no, he doesn't drink, smoke or drink alcohol or use illicit drug. He lives with his wife and the 4-year-old son. Past medical history, back pain. Past psychiatric history, none. Allergy, no known allergy. Family history, brother have anxiety disorder and depression. Mother was diagnosed with manic depression. Father is an alcoholic. His sister abused drug and alcohol. Mental status exam, no impairment in reality testing. Asset and liability, paid the house bill before he lost his job. Apply for unemployment. His wife is the only one working at the present time. Physical examination is unremarkable. Diagnosis is diagnosis and ICD-10 code is DSM-5, bipolar disorder, manic episode, hypomanic back pain. Differential diagnosis is borderline personality. Treatment, CBC, BMP, TSH, renal function test, EKG. Weight was normal. So started the patient with lithium 300 milligram PO TID for 10 days. Monitor renal function test, CBC, weight gain, level of lithium, non-pharmacological, clinical social worker recommended for his psychosocial situation. Advice, sponsor, supportive therapy, family therapy. Patient and family teaching to follow up on the lab report adverse effects such as abnormal heartbeat, frequent urination or testing, and do not stop the medication or change the dose. The second, identifying data, case study number 2, Miss K, 33 years old, Caucasian female. She is a college professor, married and live with husband and 7-year-old twin girls. Source of information was obtained from medical record and patient. Chief complaint, sadness, mood swing, severe irritability, and hyposomnia with period of insomnia and severe inappropriate guilty feeling. Current medication, bupropion 150 milligram POBID, carvedilol 3.125 milligram POBID. Past psychiatric history, bipolar disorder with major depression. Past medical history, irregular heartbeat that started 2 years ago. Allergy, no known allergy. Uncle has history of bipolar depression. Mother has manic depression. Father died of congestive heart failure and kidney failure. Live with husband and 7-year-old twin girls. Non-smoker. No illegal drugs or alcohol use. Mental status exam. Cooperative, organized speech. Appropriate insight to reality. Physical examination, no acute physical finding. Diagnostic test, CBC, CMP, TSH, liver function test were remarkable. Abnormal EKG. Differential diagnosis is borderline personality disorder. Diagnosis, major depression, DSM-5, bipolar disorder, hypomanic episode. Treatment plan, Depakote 750 milligram daily PO. Divided dose is added to mental medical regimen with stable argumentation and monitoring. Non-pharmacological intervention includes cognitive behavioral therapy, supportive therapy, and family therapy. Patient and family teaching, medication management, schedule labs, and monitor side effects such as abdominal pain, skin changes. Patient was referred to cardiologist because of abdominal EKG. Case discussion. Mr. J will benefit from lithium because he presented with mixed feature of hypomania, one stable in his mood. He began to address his problematic marriage and loss of job in assertive way. Lithium was not prescribed for Mrs. K because she has history of irregular heartbeat, which was contraindicated of lithium. Another mood stabilizer medication was prescribed for augmentation since patient is on bupropion antidepressant medication. Summary. Lithium is the first drug that is used for treatment of bipolar. It has side effects such as bradycardia, renal failure, kidney failure. So Mr. DJ was on it because it doesn't have any history of kidney failure or irregular heartbeat, and it's good for his treatment of bipolar disorder. And Mrs. K was not prescribed because he has symptoms, he has abnormal EKG, which is contraindicated of prescription of lithium. This is the end of my presentation. Thank you. This is my references.